Hello again, it's Dr. Jordan Taylor, Undergraduate Exercise Science Program Director and Associate Teaching Professor at the University of Kansas. Welcome to another episode of Fitness Facts. Today I will be discussing exercise-associated muscle cramps, theories about why these muscle cramps occur, risk factors for cramps, and prevention strategies and treatments. Toward the end of the video, I will provide you with a couple of drink options that have scientific evidence supporting their consumption for rapid relief of exercise-associated muscle cramps. One of these drinks you can make yourself with a few simple ingredients found at any grocery store, and the other is ready to go straight out of the jar. So make sure and stick around until the end of the video to see what they are and to understand why they work. Exercise-associated muscle cramps are sudden, spasmodic, involuntary contractions of skeletal muscles that typically occur during or after intense exercise or physical activity. These cramps may persist for several seconds to minutes, causing significant discomfort, pain, and impaired physical performance. Exercise-associated muscle cramps are most often observed in large muscle groups that cross two joints, such as the quadriceps, hamstrings, and calves, although they can occur in any skeletal muscle. Despite their prevalence, the exact mechanisms underlying exercise-associated muscle cramps remain unclear. However, two distinct theories have been proposed to explain the causes of exercise-associated muscle cramps. The first theory is termed the neuromuscular control theory, and the second is the electrolyte depletion theory. I will discuss these two theories in greater detail later in this video, but first I want to explain how muscle proprioceptors work, because their normal function is altered when muscle fatigue develops, and this disruption in muscle proprioceptor function is thought to contribute to the development of exercise-associated muscle cramps. So muscle proprioceptors are internal receptors located in muscle and the associated tendon that provide feedback to the central nervous system about the relative level of muscle tension, muscle length, and the contraction state of a muscle. Muscle spindles and Golgi tendon organs are proprioceptors specific to muscles. Muscle spindles are concentrated primarily in the muscle belly, running parallel to the muscle fibers, and they are sensitive to changes in muscle length, stretch, and rate of stretch. When a rapid stretch occurs, a nerve impulse is sent from the muscle spindle along an afferent neuron and into the spinal cord. In the spinal cord, afferent neurons activate alpha motor neurons of the same muscle and cause it to contract. This is known as the stretch reflex. And the knee jerk or patellar tendon reflex is an example, as shown in this image here. And I'll talk about how muscle spindles work and how this stretch reflex should normally occur. So let's talk about this muscle spindle and how it normally functions, okay? So you've probably been to a physician before, and your physician has checked your reflexes with a little hammer. And here's how a reflex normally works and how these muscle spindles are involved. So you see that muscle spindle lying there in the quadriceps muscle, which is the thigh muscle. And again, the spindle is a proprioceptor that's sensitive to changes in muscle length and stretch, and it lies parallel to those muscle fibers in the quadriceps. So what happens if a muscle is rapidly stretched? For instance, when a physician taps your patellar tendon with a hammer, the patellar tendon depresses, and that causes a quick stretch. It's so rapid, and it's not a huge stretch, but the muscle fibers change length due to that patellar tendon being tapped, and they stretch, they elongate. So that fires up that muscle spindle that lies parallel to those fibers, and if you follow the arrows along that blue 1A afferent neuron, afferent is a neuron that carries nerve impulses into the spinal cord. So there's an action potential or nerve impulse sent from the muscle spindle in response to the rapid stretch of the quadriceps. That nerve impulse is transmitted along that blue 1A afferent neuron into the spinal cord. And then you see next to the number 1 in the spinal cord, it kind of splits into two axon terminals. So next to number 1, in the spinal cord, there will be these neurotransmitters that are released that are excitatory in nature, for instance, like glutamate. That glutamate will bind to receptors on that purple alpha motor neuron that's leaving the spinal cord next to number 1. And then an action potential, a nerve impulse, will be sent along that purple neuron back to the quadriceps muscle group, and then other neurotransmitters, acetylcholine, will be released there on the muscle fibers that alpha motor neuron innervates, and that will cause those muscle fibers to contract, all right? Now, for the leg to kick out in this knee-jerk reflex, there has to be inhibition of the antagonist muscles, the hamstrings, on the other side of the thigh, right? So if you look at number 2 there in the spinal cord, you'll notice that 1A afferent neuron branching off the muscle spindle also connects to an inner neuron there in red. That inner neuron, when it's stimulated, is inhibitory. So it releases an inhibitory neurotransmitter like glycine onto that other purple, the bottom purple alpha motor neuron, and that inhibits that bottom, that purple neuron that's going to the hamstring muscle groups from firing. So basically, what you see going on here is the muscle spindle is activated by the quick stretch, and then alpha motor neurons are activated by that afferent neuron going back to the quadriceps. They contract, the leg kicks out, but in order for that leg to kick out, the alpha motor neurons going to the hamstring muscles have to stay relaxed, okay? So that's the normal function of a muscle spindle in a stretch reflex. However, in a fatigued state, let's say you're an athlete, it's hot, humid, you've been running around for hours, soccer player, football player out on the field, you build up metabolites, waste products in those muscle fibers, and this can alter the function of those muscle spindles where they're more hyperexcitable. And so it's more likely that they're sending in those nerve impulses to the spinal cord and triggering a contraction of that same muscle group where fatigue is occurring and you have waste products and metabolites building up. So it's like those muscle spindles become overactive in a fatigue state, and that's wanting to cause those muscles to contract and kind of lock up and spasm, okay? So that's the first proprioceptor, the muscle spindle. So the next proprioceptor to discuss are the Golgi tendon organs. Golgi tendon organs are located at the junction of the muscle and tendon that attaches a muscle to bone. Golgi tendon organs are sensitive to tension in the muscle-tendon complex, and they act like a strain gauge, continuously monitoring both muscle tension and force produced during active contraction. The sensory neurons arising from Golgi tendon organs are stimulated by tension within the tendon, whether caused by stretching or by contraction of the muscle. The greater the tension, the greater the stimulation. Once stimulated, sensory neurons branching from the Golgi tendon organ conduct nerve impulses, known as action potentials, into the spinal cord. The sensory neurons synapse or connect with inhibitory interneurons, which prevent alpha motor neurons from firing action potentials back to stimulate the tensed muscle. The force of contraction of the tensed muscle is therefore inhibited by the response of the Golgi tendon organs. If tension is great enough in the muscle-tendon complex, the Golgi tendon organs will completely inhibit contraction of the tensed muscle and cause it to relax. This reflex is referred to as the tendon reflex or inverse stretch reflex. The tendon reflex helps the spinal cord reduce muscle force output and protects the muscle from rupturing or tearing by turning off the active development of tension if tensile stress within the muscle is too great. Let's take a look at an image here displaying how this tendon reflex normally functions, and then I'll talk about how it's altered the function of it in like a fatigued state. All right, so if you look at this picture of the thigh again, this is a different proprioceptor. It's located near the hamstring tendon. There you see the Golgi tendon organ. It's another sensory receptor, but unlike the muscle spindles, which are sensitive to muscle stretch, elongation of fibers, the Golgi tendon organ is a different type of proprioceptor. It's sensitive to tension in the muscle that occurs with stretching or active contraction. So, again, if you look at point number 1 up there, Golgi tendon organs detect tension applied to the muscle and tendon, and they're located right near where the muscle and tendon meet. When they're stimulated by tension, sensory neurons conduct action potentials into the spinal cord. You see that sensory neuron with the number 2 labeled. So again, Golgi tendon organ senses tension, action potential, nerve impulse is triggered along that sensory neuron, and it enters the spinal cord. Then the sensory neurons synapse with, that just means they connect with, inhibitory interneurons that synapse with alpha motor neurons. So that sensory neuron is going to stimulate that black inhibitory interneuron that's located in the spinal cord. That interneuron then will inhibit by releasing inhibitory neurotransmitters like glycine or GABA. It will inhibit that alpha motor neuron that it's connected to that runs back to that same muscle group where the tension is occurring. And so the inhibition of the alpha motor neurons causes muscle relaxation, relieving the tension applied to that tendon. Okay, so you can see how this Golgi tendon organ works a little differently. Normally, when it's stimulated, it's going to cause reflex relaxation and inhibition of contraction of the muscle those tendon organs are located in. Okay, whereas the muscle spindles are going to cause contraction of the muscles that they're located in. Okay, and what happens in a fatigue state is we have a reduction in Golgi tendon organ function. So if these Golgi tendon organs aren't functioning well when the muscle is fatigued, then they're not able to send in that impulse into the spinal cord and then inhibit the alpha motor neurons that are actively causing muscle contraction in that muscle group. Okay, so basically what you see in muscles that are fatigued is the muscle spindles are overexcited. There's too much drive from the muscle spindles going into the spinal cord, and that's wanting to cause contraction back in the same group that the muscle spindles are located. And the Golgi tendon organs in a fatigue state, they're not functioning well enough. So their function is reduced or decreased, and they're not able to inhibit or cause muscle relaxation. Okay? So what role do these muscle proprioceptors play in the development of exercise-associated muscle cramps? And I kind of talked about this a little bit already, but let's go through this some more. The neuromuscular control theory suggests that exercise-associated muscle cramps happen when some aspect of control between the motor neurons that exit the spinal cord and signal muscle fibers to contract and the muscle itself becomes altered. The altered neuromuscular control theory explains how muscle fatigue can disrupt the normal functioning of muscle proprioceptors, which are the receptors I previously discussed, located in muscle and tendons that help regulate muscle length and tone or tension. As muscle fatigue develops, excitation of the muscle spindles and inhibition of the Golgi tendon organs occur, resulting in abnormal activity of the alpha motor neurons and reduced inhibitory feedback to exhausted muscles. Muscle fatigue may create a scenario which prompts an excitatory increase in muscle spindle afferent neuron activity and a simultaneous decrease in Golgi tendon organ inhibition, leading to abnormal alpha motor neuron control and sustained alpha motor neuron firing. The abnormal repeated firing of motor neuron action potentials initially presents as muscle twitches, but if muscle contraction continues, an exercise-associated muscle cramp ensues. These localized muscle cramps tend to develop when the muscle is contracting in an already shortened position. To be clear, understand that exercise-associated muscle cramps may occur when the neural mechanisms designed to inhibit muscle contraction in response to muscle tension detected by the Golgi tendon organs are disrupted or depressed. At the same time, enhanced excitatory activity from the muscle spindle triggers an intense and sustained involuntary muscle contraction that is unopposed by Golgi tendon organ control. It is now generally accepted that most exercise-associated muscle cramps are related to abnormal firing of motor neurons. For decades, scientists have debated whether cramping is of central or peripheral origin. The central or spinal origin hypothesis argues that cramps develop from hyperexcitable motor neurons that exit the spinal cord and innervate the various skeletal muscles. According to this theory, when sensory afferent neurons are activated by muscle contractions, it causes persistent inward currents in spinal motor neurons. Generation of these currents then changes the way motor neurons respond to synaptic input so that afferent signals converging on the motor neurons are amplified and prolonged. The peripheral origin hypothesis suggests that cramps result from spontaneous discharges of the motor neurons themselves. This theory proposes that mechanical actions or changes in fluid or electrolytes cause spontaneous or abnormal excitation of the motor neurons themselves with no spinal involvement. Risk factors associated with this type of cramping are age, history of cramping, and increased exercise intensity and duration, and also lack of overall fitness. Several lines of scientific evidence lend support to the theory that exercise-associated muscle cramps occur due to altered neuromuscular control. So number one here, this type of cramping is generally localized to the overworked muscle. Number two, lack of conditioning, improper training, and depletion of muscle energy stores, which are all associated with muscle fatigue, can lead to the development of exercise-associated muscle cramps. Number three, muscle cramping can be induced in the laboratory by electrical stimulation or voluntary muscle contraction with no changes in electrolytes, which suggests that the mechanism for exercise-associated muscle cramps is neuromuscular in origin. Number four, often the most effective treatment for relieving cramps is stretching of the muscle. Stretching increases tension in the muscle and in the Golgi tendon organs that inhibit the alpha motor neurons. Number five, changing excitatory properties of the motor neuron, for example, by ingesting transient receptor potential or TRP channel agonists such as mustard oil, cinnamon, wasabi, ginger, capsaicin, which is found in chili peppers, and acetic acid found in pickle juice. These TRP channel agonists have been shown to be efficacious in mitigating both electrically induced and voluntarily induced exercise-associated muscle cramps. I will discuss how to consume TRP channel agonists and the proposed mechanism by which they relieve muscle cramps later in the video. Now let's discuss the second exercise-associated muscle cramp theory. The second theory, electrolyte depletion, better describes a different type of exercise-associated muscle cramps, often referred to as heat cramps. This type of muscle cramp typically occurs in athletes who have been sweating extensively and have significant electrolyte disturbances, mainly a loss of sodium and chloride. These cramps involve large muscle groups, and their occurrence is sometimes described as locking up. This type of exertional heat cramp usually evolves from localized visible muscle fasciculations or twitches to severe debilitating muscle cramps. The cramps often begin in the legs but can become widespread throughout the body. Because a significant amount of sodium can be lost, along with a large loss of fluid, the electrolyte depletion theory is typically coupled with dehydration. Progressive dehydration and electrolyte depletion causes fluid to shift from the interstitial compartment between cells to the intravascular compartment, meaning into the blood vessels. This contracts the extracellular fluid compartment, which is the fluid outside the body cells, and increases the surrounding neurotransmitter concentrations, causing selected motor neuron terminals to become hyperexcitable, leading to spontaneous discharge and initiation of action potentials in the muscles, and ultimately exercise-associated muscle cramps. Proponents of this theory have supported the following. Number one, anecdotal evidence has existed for centuries that laborers working in hot and humid conditions suffered from cramping. Number two, in those laborers, ingesting small volumes of salt water prevented or alleviated the cramps. Number three, increases in sweat sodium concentration or salty sweating is evident in tennis and American football players who are most prone to cramping. It should be noted that changes in fluid and electrolytes may still cause cramping through spontaneous discharges of the motor neurons according to the peripheral neuromuscular control theory. At this point, you may be wondering, how do I prevent and treat muscle cramps? To prevent exercise-associated muscle cramps, you should, number one, be well conditioned for your sport or exercise to reduce the likelihood of muscle fatigue. Number two, regularly stretch the muscle groups that you have found to be prone to exercise-associated muscle cramps. Number three, maintain fluid and electrolyte balance and carbohydrate stores, glycogen stores in the muscle and liver. Number four, reduce exercise intensity and duration at the onset of muscle fasciculations. A fasciculation, again, is just a visible involuntary twitching of a muscle. The quickest and most effective method to treat exercise-associated muscle cramps is to hold the muscle that is cramping in a stretched position. Massaging, icing, and resting the affected muscle are also good treatment approaches. Electrolyte-containing fluids should be consumed if dehydration and electrolyte loss, especially sodium and chloride, are suspected. Ingestion of a high salt solution containing 3 grams of salt and 500 milliliters of water every 5 to 10 minutes or intravenous fluid and sodium loading may alleviate cramping. A 2010 study published in the journal Medicine and Science in Sports and Exercise titled Reflex Inhibition of Electrically Induced Muscle Cramps in Hypohydrated Humans showed that ingesting pickle juice at a dose of 1 milliliter per kilogram of body weight rapidly alleviated muscle cramps. The pickle juice required approximately 85 seconds to alleviate muscle cramps, and cramp duration after ingestion ranged from 12 to 219 seconds. The authors of this study stated, in conclusion, pickle juice and not deionized water significantly shortens electrically induced muscle cramp duration in mildly hypohydrated humans. How pickle juice decreases cramp duration is unknown. However, we hypothesize that it triggers an inhibitory oropharyngeal reflex, that's in the back of the throat, shortly after ingestion, which reduces alpha motor neuron activity to cramping muscles. This decrease in cramp duration after pickle juice ingestion is likely not due to the changes in body fluid chemistry, a placebo effect, spontaneous cessation, or a lack of fluid and electrolyte loss because of experimentation. The ingredient in pickle juice that elicits the decrease in cramp duration is also unknown, although acetic acid could play a role in triggering an oropharyngeal reflex. Acetic acid is a known transient receptor potential channel agonist, also known as a TRP channel agonist. TRP channels are ion channels located in the mucosal linings and sensory nerves within the oropharynx, which is the middle part of the throat behind the mouth. Little is known about these TRP channels, but they have been found to be stimulated by weak acids such as acetic acid in pickle juice. TRP channel activation has many effects, including decreasing muscle tension. Consuming pickle juice or other TRP channel agonists such as mustard oil, cinnamon, wasabi, ginger, and capsaicin, which is found in chili peppers, may trigger an inhibitory stimulus from a supraspinal source that activates inhibitory interneurons in the spinal cord. Activation of these interneurons may postsynaptically inhibit the alpha motor neurons that exit the spinal cord and innervate the cramping muscle. In rats, intraperitoneal injection of acetic acid increases the release of inhibitory neurotransmitters such as serine and glycine in the dorsal horn of the spinal cord. Glycine is an especially potent inhibitory neurotransmitter in the spinal cord that may increase inhibitory interneuron activity in Renshaw cells or decrease activity in alpha motor neurons located in the ventral horn of the spinal cord because these neurons have a high affinity for glycine. So, an increase in inhibitory neurotransmitter activity triggered by pickle juice ingestion or the ingestion of other TRP channel agonists I previously mentioned could be involved in the alleviation of muscle cramps. In a 2017 study published by Daniel Craighead and colleagues titled Ingestion of Transient Receptor Potential Channel Agonists Attenuates Exercise-Induced Muscle Cramps, subjects in the active treatment group received a proprietary blend of TRP channel agonists including one or more of the following: capsaicin up to 38 milligrams, cinnamon up to 500 milligrams, and ginger up to 750 milligrams, dissolved in a fruit-flavored base. The authors of this study concluded that consumption of these TRP channel agonists and the resulting TRP channel activation may have dampened alpha motor neuron hyperexcitability to mitigate cramping in the calf muscles. How can you ingest these other TRP channel agonists to potentially help rapidly relieve an exercise-associated muscle cramp? Well, lucky for you, I have a drink you can mix up yourself and try. Have it with you on practice or game days. You may like it or you may not, but remember you're drinking this not for the taste, but for the possible effect of muscle cramp relief. Okay, so let's talk about this drink concoction that you can make that does have some scientific evidence for relieving muscle cramps with these various TRP channel agonists sprinkled into the drink. So the first thing you want to start with, obviously get your shaker cup, get your base. I recommend using orange juice. You could use apple juice, so like a fruit-flavored base, or I'm going to use Gatorade. And why Gatorade? Well, Gatorade, is high in sodium, and If you're exercising in a hot, humid environment and you're sweating a lot, and some people sweat out more sodium than others, then you may get depleted in that sodium and you may start becoming dehydrated. Your electrolyte level of sodium is going down. And that tends to lead to more widespread cramping throughout the body, not just in one muscle group, but you'll see it more widespread. So that could clue you in that you're low on sodium and electrolytes. And a lot of people, they think you lose potassium in sweat, a lot of potassium. You lose some, but you mainly lose sodium. And you've probably heard them, like somebody recommend eat a banana because it's high in potassium, but probably won't do much for you for your cramps. So again, there's 270 milligrams of sodium in this 20 fluid ounces of Gatorade here. You've got carbohydrate, again, keeping your carbohydrate levels up and having plenty of muscle glycogen to delay the onset of fatigue. That could play a role in helping reduce the likelihood of you sustaining a muscle cramp. So again, electrolytes, got potassium, 80 milligrams. So again, that's why I'm using this sports drink. The sugar, the carbohydrate to keep your glycogen stores up, and then the electrolytes. So just pour this in. All right. And then we've got our base in there. Now we're going to start adding in our TRP channel agonists, which I explained how these initiate that reflex in the back of the mouth and throat that is thought to activate inhibitory interneurons in the spinal cord, which inhibit the alpha motor neurons going to those cramping muscles, so they're not receiving that electrical chemical impulse to contract, and then hopefully that relieves your cramp in a shorter period of time than what otherwise would happen if you weren't ingesting this. Now, I don't know, you may like this, you may not. If you don't like this concoction I'm making, I have another drink option I'm going to show you in a second. But just sprinkle in a couple, 1, 2, 3 dashes of ground cinnamon. That's the first ingredient, right? So ground cinnamon. Love the smell of cinnamon. Next ingredient, TRP channel agonist, is ground ginger. All right, so a couple, 1, 2, 3. There you go. It's not wanting to come out. There you go. So I got the ground ginger in there. And then the last one, this is going to leave some heat in the back of your throat. But again, it's another TRP channel agonist. This is cayenne pepper, okay? And cayenne pepper has capsaicin in it, which again, capsaicin is the chemical that's been found to stimulate those ion channels, those TRP agonist channels in the back of the throat. So we'll sprinkle in a couple, 2, 3 sprinkles there of the cayenne pepper. Mix it all up, mix it good. I've actually tried this once before, and it's actually not too bad, but you can watch my face and see if I make any weird facial expressions after drinking this. So I've got that stirred up good. I'm going to take a good chug here. It's actually really not that bad. After you drink it, that cayenne pepper will stick around. It'll kind of feel that in the back of your throat. But again, that's one drink option that you can use. So if you can't stand the taste of this concoction, just stick to consuming 1 milliliter of pickle juice per kilogram of body weight to try and relieve your muscle cramps. To figure your dose, first you need to figure your weight in kilograms. To do this, divide your weight in pounds by 2.2. Using myself as an example, I weigh 170 pounds, which is equal to 77.3 kilograms. So if I had a muscle cramp, I would need to ingest 77.3 milliliters of pickle juice. This is the equivalent of 1 milliliter of pickle juice per kilogram of my body weight. All right, so the second option you have for potentially relieving your exercise-associated muscle cramps is to consume pickle juice, which I actually like, all right? So you may have seen some images on an NFL sideline of an athletic trainer administering, giving one of the players pickle juice to drink. And you may have thought, man, okay, I've heard about this before. Isn't it because of the sodium content that's in the pickle juice? It's actually not. They believe what relieves the muscle cramps, again, is the acetic acid. So the vinegar that's in the pickle juice, that's what stimulates those TRP channel agonists, those ion channels in the back of the throat, and then causes that reflex down the spinal cord that helps to switch off the alpha motor neurons so that nerve impulses are not getting sent to those cramping muscles. Okay, so got my pickle juice here, poured it in my shaker cup. I'm sure many of you have tasted this before, but just drink this. You know, maybe I actually like the other concoction better. I thought I liked pickle juice, and I've drank it before. But yeah, that's I can definitely taste the vinegar, that's for sure. So either option works. They both have those TRP channel agonists in them. Pick what you like. Like I mentioned, you need to figure your weight in kilograms to get the correct dose, and then drink 1 milliliter of pickle juice per kilogram of your body weight. That's the important part, right? Is getting the dose correct. I covered a lot of information in this episode, so let me provide a summary of key points. Number 1, muscle fatigue associated cramps are related to sustained alpha motor neuron activity with increased muscle spindle activity and decreased Golgi tendon organ activity. Number 2, exercise-associated muscle cramps may be caused by altered neuromuscular control, fluid or electrolyte imbalances, or both. Number 3, heat-associated cramps, which typically occur in athletes who have been sweating excessively, involve a shift in fluid from the interstitial space to the intravascular space, resulting in a hyperexcitable neuromuscular junction. Number 4, rest, passive stretching, holding the muscle in the stretched position, and fluid and electrolyte restoration can be effective in treating exercise-associated muscle cramps. Number 5, proper conditioning, stretching, nutrition, and hydration are possible strategies to reduce the likelihood of muscle cramps occurring. Hope you enjoyed this episode about exercise-associated muscle cramps. If you have questions for me about the KU Exercise Science Program, send an email to jtaylor@ku.edu or call 913-897-8516. As always, thanks for watching Fitness Facts.